Welcome. This is Chapter 8 in Math 101 on safety and medication administration. We want to go through this and address some of these very important points which are not necessarily directly related to calculating dosages. Okay? So we're going to talk about the need for patient safety programs, the impact of medical errors on patient outcomes, describe strategies to maintain patient and staff safety during medication administration, ID the special problems and issues of the elderly population related to administration. So patient safety practices during medication administration improve competitiveness, regulatory compliance, and patient outcome. Okay. You might well ask, well, what do you mean by competitiveness? Okay, and the answer is that the better your quality of healthcare is, meaning mistake-free, the more likely it is that you're going to run a better facility, gain more patients, and become more successful and more profitable. Okay. Regulatory compliance is simply acknowledging that you are adhering to the rules, okay, with regard to patient safety and the 6 rights, which we'll get into in a bit. And patient outcome is simply a way of saying, what were the results, okay? Factors that work against patient safety. This is a fast-paced environment, a lot of advanced tech. Staffing can be stretched a bit, all right? An aging population means that it's critical not only that we have proper education, but also proper monitoring during that process so that they understand how to get the proper dose, the proper way, at the proper time, okay? And the proper med, okay? And chronic diseases are simply a classification of conditions that are ongoing and often result in cumulative damage. And that means that you have to monitor the patient and their meds for a long period of time. Okay? Declining financial resources means that everything is going to be set up to be cost effective, and that may end up conflicting with the ability to provide the patient what they need in order to adequately manage their condition. Okay. External pressures for patient safety. Centers for Medicare and Medicaid Services, the Joint Commission, the Leapfrog Group, and other state agencies. Okay. And what these do is they try to control cost, all right, and they try to enforce regulations, and that can be a challenge when you're short-staffed and when you're stretched financially, okay. Potential negative outcomes, increased cost of care, complications delaying healing or the ability to return home, physical or psychological harm, or even death, okay. Examples, right? Scenario A, a 6-year-old is admitted with suspected pyelonephritis and dehydration caused by nausea and vomiting. Tests require meds before testing. The medication name is similar to a cardiac drug. The nurse commits an error in checking the name and calculating the dose. The child experienced cardiac arrest with long-term consequences. So how could this have been avoided? Okay, and the answer is very simple. All right, 2 sets of eyes on every computation, including identifying the drug and also computing the proper dose. All right, and comparing that to what the doctor's orders are. In addition, all right, proper education of staff in order to avoid those kinds of problems. All right. Scenario B, A 26-year-old woman is admitted for surgery. She's allergic to a lot of meds, including antibiotics. Post-op orders include that antibiotic, resulting in anaphylaxis and cardiac arrest. After administration of the drug, and the patient dies. All right. How could this error have been avoided? And the answer is a proper patient history, and that all staff be aware of that history and be able to read and understand the chart. And that comes down to education of staff. All right. And this is one of the reasons you're here at OMCC, right? In order to be able to do these things without error and provide the optimum patient outcome. Okay. The QSEN project aims to prepare student nurses with the knowledge, the skills, and the attitudes needed to improve the quality and safety of patient care. It looks at 6 areas of patient care, including safety and informatics. Safety refers to reducing the risk of harm to the patient. Informatics is the tech used to mitigate those errors. By mitigate, we mean reduce them. Okay? Hopefully eliminate them. To reduce med errors, it's the responsibility of each healthcare worker to practice within the scope of his or her position, observe correct safety practices, and adhere to established standards of care. And here we get into website resources, right? www.ismp.org is the Institute for Safe Medication Practices. It's dedicated to education awareness and tools for the prevention of med errors. Now we get into the 6 rights of medication administration, which include right dose, right drug, right patient, right route, right time, right documentation. Okay? An example of a problem, right? How would you respond if the patient told you the heart pill they take at home is different color from the pill that you're trying to administer? Okay? And this is part of patient education, which is part of what you have to administer to the patients under your care. Right? So let's take a look at the 6 rights.
To ensure the 6 rights of medication administration, first review the medication order. It should include the patient's full name, the date the order was written, and if applicable, the date it expires, the drug's name and dose, the route and frequency or timing of administration, the reason for administration for a PRN medication, and the prescriber's signature. Now observe the 6 rights, starting with the right medication. When a medication is first ordered, compare the prescriber's written order with the medication administration record, or MAR, or with the computer's order screen. When administering the drug, compare the label in the drug container with the MAR 3 times. Once before removing the drug from the drawer or shelf, once before placing the drug in a medicine cup or taking it to the patient's room, and once again before administering the drug at bedside. With unit dose medication, leave the medication in the blister pack and perform the final check before opening it at the patient's bedside. If you must prepare a dose from a larger volume or strength, or if the prescriber orders it in a system of measurement that's different from what the pharmacy supplies, calculate the dose or conversion carefully. Next, make sure you have the right dose.
Hi. Hi. Could you verify this drug calculation for me?
Sure.
Ask another nurse to do the same calculation independently. Then compare your calculations.
This is what I got.
All right, great. Thank you.
Thank you.
To help ensure the right dose, prepare it using a standard measuring device, such as a graduated cup or syringe, and follow these guidelines. For a liquid medication, hold the medication cup at eye level. Ensure that the cup is held level while pouring the medication. Pour the medication away from the label to avoid drips that may make the label hard to read. Then make sure the poured dose is even with the base of the meniscus. For a medication drawn into a needleless syringe, Draw it in slowly to prevent air bubbles from entering the syringe. Air can displace the medication, producing an inaccurate dose. Then place a completed medication label on the syringe.
Hi there.
Hi.
How are you today?
Fine.
When you're ready to
Good.
administer a medication, ensure that you have the right patient using two identifiers. For example, check his identification band, compare with the MAR, and ask
How's
the
your day
patient
going?
to state his
Good.
full name and date of
Pretty
birth.
good.
Do not use the patient's room number for identification.
Can you tell me your name?
Yes, Raymond Kenneth,
And what's your birthday?
May 29th, 1956.
Great.
Next,
Some laces
ensure that
for
the
you,
medication
and
is
I'm
for the
gonna
right
get
route
your
based on the
ID.
prescriber's order. If the route is missing, or if it's not the recommended route, consult the prescriber immediately. For an injection, be sure to use only a preparation intended for parenteral use. Injection of an oral liquid can cause serious adverse effects. To prevent this problem, remember that parenteral medications are labeled for injectable use only. To observe the right time, follow your facility's recommended schedule for medications ordered at frequent intervals. For instance, give routinely ordered medications within 30 or 60 minutes before or after the scheduled time.
Hi.
Hi.
How are you?
Fine, and you?
Good.
As
good.
needed, use your nursing judgment about the
Can
timing.
you tell me your name
Yes, Raymond Kenneth,
and your birthday?
May 29th, 1956.
Very good.
For example, if a drug must be given with food, administer it within 30 minutes of the meal. Also, give medications at specific times as prescribed. For example, give a stat drug immediately. Administer a drug ordered for now as soon as it's available, usually within 1 hour. Give an on-call drug when the operating room or treatment area requests it. Provide an AC drug before meals or a PC drug after meals. Give a PRN drug according to circumstances or when needed. Finally, observe the right documentation, recording your entry as soon as possible after giving the drug, as shown in the video skill, Documenting Medication Administration.
Hi.
Hi.
How you feeling?
Good.
Good.
As part of your follow-up care, teach the patient about the medication and continue to avoid medication errors, as shown in the video skill, Preventing Medication Errors.
I wanted to tell you a little bit about your Fiasol since it's a new medication for you. You might notice that your stool is a little darker. You might feel.
This skill is medication administration. Okay, before we start the skill, I want to talk to you about the MAR, the Medication Administration Record. If you look here, we've got the patient's name here, we've got their date of birth, we have their patient or medical records number, then we actually have their room number. We also have all the medications they need. We have the date across the top where we would actually be initially. As we go through here, if you remember in your book, you've got the 6 rights. You need to be concerned with the right patient. If you look here, the right drug, the right dose, the right route, and the right time. And then the 6th right is the documentation when you finish giving the medication. So I'm going to go through a few of these because there's a couple errors on this MAR that I want to talk to you about that you need to always be careful about. Okay, the first one talks about Practi-Dig. That's the name of the medication. The strength is 0, and notice that leading 0, 0.25 milligrams. Then you've actually got the route, which is PO by mouth. Then you have, it talks about special precautions, hold if the pulse is less than 60 beats per minute. And then you've got the actual time it's due. Okay, that's the way a medication should be actually set up for you. You should also have the dates over here, and nobody should have signed in your spot. Like I'm going to give the 0900s in just a little bit. Nobody has signed in my spot, so supposedly no one has given that medication. If someone had signed in my spot helping me out and maybe they gave the medication for me and I didn't realize it, hopefully I would be alerted because I would have read all of this information here and then went over and looked under the date and the time that I was actually going to give medications. Now, I've highlighted in yellow some things you have to look out for. The next order says Tagamet, And what it's got here is Tagamet 1 capsule PO, TID, AC. Okay, Tagamet is the drug. The 1 capsule doesn't help me any. It doesn't give me the dosage. You should never give a medication without an actual milligrams, milliliters, micrograms, some type of dosage, even units. So that's an error right here with that. The actual frequency is 3 times a day before meals, so that's okay there. The PO is the actual route, and obviously the patient is here. Now, if you look at the next one where there's a problem, if you notice the allergies in the red across the bottom, it says aspirin, penicillin, and triple antibiotic ointment. When you get ready to give meds, you should always scan through and look at all the medications, not just the ones you're going to give for your time. Scan through and look at all of them. As it turns out, this triple antibiotic ointment applied to the lesion on the left thumb, BID, at 9 o'clock, well, the drug is there. The actual applying part is talking about the skin topical, so that's there. It tells me how often to do it, and there's not a real strength with this one, but there is a time. But my major issue is allergies. They're allergic to this. So how in the world did that get on this page? So what you want to do when you find something like that is take and DC it completely off, discontinue it, pull it out of the drawer. If you're on a unit dose or if you're on a blister pack system, not on a Pyxis, pull it out of the drawer and alert the prescriber, the physician, nurse practitioner, and also alert pharmacy. So those are some errors that you can find on an MAR that you need to be cognitive of and always be looking for when you're giving medications. Now, I just want to show you, in long-term care, we use what they call blister packs. These are blister packs where you'll have usually a 31-day to 32-day dose. They send them down once a month. So you pop them out. These are used. I had brought from the long-term care facility I go to so you could see what a blister pack is. Now, acute care does not use blister packs. The patients come and go too fast. They would be destroying more medicines than they were giving. These are unit dose right here, what I've got. These are things you'll see in the Pyxis that you'll pull out, or maybe if you just have a regular patient drawer like we're going to be using in just a little bit. This is a unit dose. That means I open it up, I give the medication, I toss these away. Okay. Now, what I'd like to do now is to go and start the actual skill, the actual medication administration skill that we're going to be doing. Those were just some preliminaries that I think you need to know about before we actually get started. When you get ready to give your medications, you always want to go and take the MAR and compare it to the doctor's orders on the chart. What you're going to look for there, number one, is allergies to make sure what's on the MAR is what they actually have on the doctor's orders chart. You want to also look at their history, know a little bit about the history. If you've got someone that has an allergy to some type of aspirin or NSAIDs, then obviously we would not want to see them on the MAR. So look at their history, look at their allergies. You may also need to look at their lab work if you're going to take and give Lasix maybe. That has a tendency to take and pull off your potassium. So you want to also check your lab for the potassium. If I was going to give Dilantin, I want to check my levels in the lab section. So there's certain things you need to check. If I'm going to give beta blockers or calcium channel blockers, or I'm going to give digoxin, I would need to look at vital signs from previous shifts. And then I would also need to go to the room and check blood pressure and pulse before I gave those. So with what we're getting ready to do now, I would not even start without having gone and checked my labs, went and checked to see if I need to give vital signs, get a pulse and a blood pressure. And in this case, I know I'm going to give digoxin, so I'm going to take and get a pulse, an apical pulse. And I already have that, and my pulse rate was 64, so I know I'm okay to give that medicine. Okay? Now you want to come on over. You've got through with the chart, and you've assessed all of those areas. You want to come over, and you want to take and wash your hands, because what you're getting ready to do now is go and gather up your supplies and then go to the med cart. Okay, so now I'm at the med cart. I have my cups that I need. Okay. My water pitcher with my water. So we're ready to get started with this. I'm going to unlock the medicine cabinet here so I can actually get into it. And the medicine cabinet, by the way, should stay locked all the time when you're not standing right at it. And you should never leave medications on the cart. So in this case, we've got an actual drawer that has Mary Johnson's name. On the MAR is Mary Johnson also. And hopefully when we get to the room, her armband's going to say Mary Johnson, and she will agree that her name is Mary Johnson. When you're dealing with acute care, though, you'll have to do 2 ID checks. The armband, and most of the time, most places like the date of birth. Long-term care, we don't have armbands, but we have pictures that identify the resident. All right, now the first thing I see here is I need to take and give Practi-Dig. So I want to find that and get that out. With my Practi-Dig, what I'm going to do is look for the name of the medication, look for the strain, and then look for the expiration date to make sure that it has not expired. And remember when I was talking about Dig, it says Practi-Dig 0.25 milligrams, tab, PO daily, hold if the pulse is less than 60. Remember, I got a 64. So I'm going to go ahead and write that in my column under the 8/16, 9 o'clock. That's today's date when I'm actually giving the meds. I'm going to take and leave this here. When I pulled it out, I'm going to lay it down after I did all my checks. The next thing I have to give, okay, looks like Robitussin. I pull my Robitussin out. It says Robitussin cough syrup, and it looks like they want me to give 50 milligrams per 5 milliliters, and I'm to give a PO after meals. Okay. Now the other thing I want to look for is my expiration date. It expires 2 February 2021. Got a long expiration date. Okay. So I set that to the side. Now sometimes if you have a lot of medications to give, people like to put a little dot as they go along in their column to let them know they've got the medicine out, and you certainly can do that. Now, my third 9 o'clock was that triple antibiotic ointment, but remember, we had an allergy to it. So the first thing I want to do is pull that out of their drawer, and I want to send it back to pharmacy. And I want to discontinue it here so someone don't come along and accidentally give it and not notice those allergies. So always, always, always check your allergies, and you want to check, if you have 6 pages of MARs, you want to check every page. Okay? So we're going to leave this pulled out, and I'm going to send this down to pharmacy. Okay, so it looks like I don't have anything else to give. So now that was my first check. Now I'm going to go and do my second check. Okay, my digoxin, 0.25 milligram tabs, PO, daily. My heart rate was 64, so that's perfectly all right to give. I've already checked it a second time. I'm going to put it in my cup. I am not going to open it until I get to the patient's bedside. Now, if you're dealing with blister packs, obviously we got to pop those and open those right at the cart. We can't take the whole cart of the pack in the room. Now, the next thing I need to give is Robitussin cough syrup, 50 milligrams per 5 milliliter, and it's PO, and it's before, after meals. What I was getting ready to tell you was that any suspension you would need to shake, this is not a suspension, so you do not need to shake it. But anything that's considered a suspension, you will need to shake. And what I'm doing is getting an alcohol prep ready to wipe off the edge when I pour. Okay, now, you can either set this here and pour from this way, or you can hold it up to eye level and pour. I usually do better if I hold it towards the light. Alrighty. And I want to wipe it off so it's not so sticky when you put it back away. Now, since I had to pour this here, I'm going to have to do my third check here. I'm not going to be able to take all of this down to the room and then bring it back to the cart. So I'm going to go ahead and do my third check. Robitussin, it's 50 milligrams per 5 milliliter, and the expiration date's good. Okay, so we'll go ahead and put that in here. Now, there's another one that I have here. It's called the Beta Optic. And the thing about eye drops, y'all, be extremely careful that it says optic or eye or ophthalmic somewhere on it. You don't want to put an otic, which is for the ear, and an eye. So always make sure it says that. This one here says Beta Optic, and it's going to be solution, 1 drop to the right eye, and it looks like they want to do it twice a day. Okay? So now, as I go through here, I don't see any other medications. I'm going to check my Beta Optics ophthalmic solution one more time to get my second check in, and definitely looking for that ophthalmic on it. So now, there, we've got our medicines. I don't see any more. I don't get a second check on them. I'm going to get a little tray. Sometimes you'll have these trays and sometimes you won't. They're nice if you have them. Okay? You can go ahead and pour water if you don't think you have any in the room. Now, as I get down to the room, I've got some decisions to make. I've got a PO, I've got an I, and I've got a cough medicine. I would take and give my PO first, then I would follow off with my cough medicine. With cough medicine, ask them not to drink for about 5 to 10 minutes after they've had it. And then I would follow with the eye drop. Sometimes the eye drops will make their vision blurry or burn, and you don't want to give that first and then trying to get them to take all the rest of the medications. Okay. All right, so everything's here ready to go. I'm going to put this back in the cart. Going to lock it up. Okay. And either you carry the key on you or in your pocket like it, or some of them have the little wristbands you can carry it on. Okay, this is going to be sent to pharmacy, and I'm not going to leave it land on my cart because I'm afraid someone might come by that's confused or something and use it. So this is going down to pharmacy. Now, we're all ready to go. We're going down to the room. Knock, knock.
Hi.
Hey, good morning.
Good morning.
How are you?
Good. How are you?
I'm doing well. How's things going this morning?
Good.
Good. Mrs. Johnson, I've got your 9 o'clock medicines this morning. I'm not sure if you're familiar with what you've been getting, but what we've got here is your digoxin, which is for your heart. It helps your heart to beat stronger. A little bit slower, but stronger
That's
to
a
get
new
the blood
one.
out.
Mhm.
Okay. If you'd like, I can get you some information on it later on this
That would
morning.
be helpful,
Okay,
thanks.
very good. Because we'll teach you how to count your pulse before you go home.
Oh, good. Okay.
The eye drop you've been taking for your glaucoma, I think, for
Mhm.
quite some time, and we'll put that in your right eye.
Okay.
And then you had requested some cough medicine, so
Mhm.
I've got some cough medicine here for you. Okay, with the cough medicine, I'll give that after I give you a pill. If you could wait to drink about 5 to 10 minutes.
Okay.
Now, let me just check your armband,
Mm-hmm.
and I'm checking it against her MAR, Mrs. Johnson. And could you tell me your date of birth?
Mm-hmm. It's June 9th, 1945.
Thank you very much. Okay, that all matches. Very good. Okay. Now, we have some water here. Would that be okay?
Sure.
Now, are you able to swallow okay?
Mhm.
You're not having any issues with
No.
swallowing pills?
No, just this little cough, that's all.
Okay. And you're okay sitting up where you're at?
Mhm.
You can swallow okay?
Mhm.
All right. I'm going to do my third check. Okay. Digiox, 0.25 milligrams. PO, it's daily, and her heart rate was 64, and it needed to be above 60. Okay. Open it up. And if she wants to keep this, I let them keep it if they want to look their medicines up, or you can just toss it. Or sometimes students will put it in their pocket so they can go home and they start a little thing with labels on the meds they give. It's whichever you want to do with it. Okay. Want to wet your mouth first?
Mm-hmm.
Okay.
Okay.
Are you okay to take your pill?
Mhm.
All right. Thank you. Thank you. Now, if they're not able to take their medicine like she did, you will need to have a spoon. You cannot pick the pills up with your hand, even with gloves on. You take a spoon and put them in her mouth. JACO and State from long-term care will nail you in a heartbeat if you touch medicine with your bare hands. And they don't even like for us to do it with gloves on. They usually recommend a spoon. Okay. Now I'm just going to let you take your cough medicine. Okay.
This tastes bad.
It does. I'm so sorry. And you need to wait 5 minutes though, okay? Yeah, thank you so much. Okay. Now, let you just take a little break and swallow that. Because
Okay.
it kind of can take your breath away, can't it?
Mm-hmm.
Feeling a little better?
Mm-hmm.
Okay. All right. Ready for your eye drop?
Sure.
Okay, now this is going to go in your right eye.
Right.
Okay, so we're going to check it again.
Mm-hmm.
Right eye. Okay, if you can just tilt your head back. Okay. All right. Going to go right down in the conjunctiva. Okay,
Okay.
there we go. One more drop. You okay? All
Mhm.
right. Okay.
Mm-hmm.
Okay.
Okay.
All right. Does it sting or make your vision a little bit blurry?
Just a little bit, just for a second. Not bad.
All right. Sometimes we'll give medicines that we actually have to hold our finger and our nasal lacrimal duct so it doesn't get into our system.
Oh,
So
okay.
occasionally you may have a medicine that you may take with your glaucoma that they recommend that for.
Okay.
Okay, any questions?
No,
Hey, can I get anything for you?
no, I don't think so. I'm fine.
Okay, all right, well, here's your call light back again.
Okay, thank you. Mhm.
We'll be down probably in about 30 minutes with physical therapy to get you up and get you moving.
Okay, good.
Okay?
All right. Thank
All
you.
right, if you do need anything, just let me know.
Okay. Thanks.
You're welcome. Okay, now what we'll do is go back, and now that we've actually given these, we will take and actually sign them off, because we don't want to sign them off until we give them. So you can come out of the room, and you should sign your medicines off within 30 minutes, preferably just as soon as you walk from the room. So now I'll go ahead and sign my meds off, and all I'm doing is putting my initials here in the 9 o'clock spots. And remember, I discontinued the triple antibiotic ointment.
Strategies to promote patient safety include knowledge of the patient's medical history, including drug allergies and med history, a knowledge of the do not use abbreviations. We've talked a little bit about these in class already. There are certain standards for documentation that you have to use in order to avoid confusion, and the use of electronic IV pumps. Personal protective equipment for your safety. PPE includes eye goggles, masks, gowns, gloves. Okay. In some cases, all of these are disposable. In other cases, certain of these are disposable, and certain of these are submitted to a cleaning procedure and then reused. All right. It all depends on the institution. Okay. Sharps containers for disposal shown here. The biohazard label is clearly seen. Okay. And the idea here is to avoid puncture wounds, which could not only provide injury, but the possibility for infection. Okay. So let's take a look at some of the safety precautions involving sharps.
Draw up medication as you normally would. You may inject air into a vial if necessary. Measure the medication dose using the leading edge of the black plunger seal. The retraction mechanism on top of the plunger seal will not interfere with measurement and has been accounted for in the calibrations. When injecting, fully depress the plunger to give the complete dose and activate the retraction mechanism. Using your thumb to depress the plunger and positioning your fingers under the flanges will allow you to easily squeeze through the slight resistance point. In one easy step, the needle is automatically retracted directly from the patient, preventing exposure to the contaminated needle and virtually eliminating the risk of a needle stick injury.
Prevent M safety syringes with technology by Magellan feature a single-handed needle-based safety device designed to maximize your protection from needle sticks and other sharps-related injuries. After injection, immediately push up the lever arm to activate the shielding mechanism. Prevent M safety syringes with technology by Magellan are sterile, disposable, and designed for single use only. Syringes are also color-coded to easily identify different gauges.
Ways to reduce risk of injury: consistent use of PPE, consistent and appropriate use of safety devices, proper disposal techniques, consistent safety practice, and monitoring of the environment for safety hazards, and also, and most importantly, appropriate documentation and communication amongst staff. Automated medication dispensing systems are special cabinets that house meds to be dispensed to a specific patient care unit. Cabinets are connected to a central pharmacy. These are one of the ways used to improve accuracy and efficiency of delivering meds to the patient. But again, you don't want to rely on this as a crutch. You want to be able to independently verify that you are providing the 6 rights to the patient and cross-check that with what you get from the AMDS. Okay? Advantages: eliminates the need for special trips to central pharmacy, reduce med errors, allow quick administration of pain meds as needed, reduce the time needed for end-of-shift narcotic counts, reduce staff dissatisfaction and unnecessary overtime. Okay? How does this type of system increase the safety for patients? Automated medication dispensing systems reduce med errors. Some systems allow only the drawer housing the ordered med to be opened. Automatic documentation also leads to safer med administration because manual documentation is no longer necessary. It's possible for the wrong med to be loaded into the dispensing system. The nurse must continue to perform the 3 medicine checks. Meds may be mishandled while drawers are open, and lines may form when several nurses need the meds. Although AMDSs have a lot of advantages, there's times when mishandled meds make the machines a disadvantage. Mishandling of meds can cause medication to be placed in the wrong drawer by either the pharmacy or another nurse. The nurse should never assume that the med in the drawer is the correct one and should always perform the 3 med checks. Medication errors with the elderly include omission, incorrect dosage, wrong time, and misunderstanding directions. Okay? The most common med errors made by elderly patients occur in the home more so than in the healthcare facility. Omission can be a product of forgetfulness or may be caused by the patient's concern about the financial cost of taking the prescription as frequently as ordered. In other words, trying to save money. Other med errors result from the patients taking the incorrect dose or taking doses at the incorrect